All right. Okay, sorry, my computer was going a little slow. Welcome everyone to the Region 3 Planning and Policy Council meeting, the first one of 2022, if you can believe it. My name is Kirby Fye. I'm with the department. Just a few things to go over. As you can see, we're still continuing to meet virtually in order to keep everyone safe during this new variant that's going around with the pandemic. And we'll reassess every quarter to kind of see where we're at. We just want to make sure that everyone is safe and we're able to continue to meet. With that being said, the meeting is being recorded per the Open Meetings Act, and it will be posted to the department website within the next day or two. So please make sure your computer and or phone is muted just to prevent any feedback from coming through. And please also state your name if you're asking a question or making a comment. It's helpful when capturing the minutes. Also, if you've joined via phone, if you find, I haven't muted everyone, but if you join via phone and you're talking and you can't get through, sometimes you need to hit *6 to unmute. So I just wanted to put that out there as well. So I'm going to go ahead and go through the attendance, and I'm going to start with the individuals who have joined via computer first, and then I'll go to the individuals who have joined via phone. So like I said, my name is Kirby Fye. I'm with the department. We have Amy Irvin, Anna Pertano-Biggs, Avis Easley with the department, Donna Maddox, Evelyn Knight, Gail Lodato, Gina Turley, Glenn Says, Jack Blum, Kale Sarter, Kara Coleman, Kathy Milam, Deanna King, Kubra or Cal Bryant, Kurt Hipple with the department, Laura Pierce, Nicole Bates, Ruben, is it Muriente? Did I pronounce that correctly?
Yes, ma'am.
Okay. Trish Cunningham, William Douglas Webb, and then we have one individual who has joined via phone. Can you please state your name?
John Rust with the Power Putnam and the DEC grant.
Oh, hi, John. Welcome. John and I go way back.
Yeah.
Welcome. It's nice to have you on the call. Okay, I'm going to go ahead and hand it over to Deanna and Gail.
Thank you, Kirby. Good morning, everyone. Welcome to Region 3. First, we want to get a approval of our October minutes. I sent that last week in the meeting invite with the agenda. So if I could get a motion to approve.
Yeah, so moved.
Thank you. And a second?
And I second.
Great. Thank you so much. The next thing is the department report by Kirby again.
Okay, let me pull that up. Hold on one second. Okay. All right, so just quite a few things to go over since we last met in October. The first, probably most important right now, is the 2022 needs assessment worksheets should be completed and submitted back to me via email on or before April 1st. I know we'll be talking about this in more detail later on in the meeting, and I can give you even more information as we go along, but just a little reminder that that's when they're due. And I've included a link to the Fast Facts portal, which can be found on the department website. It's helpful. It's a tool to use when gathering the required data to support your needs, not required, just a tool to help you along. The FY21 Joint Annual Report has been completed and posted to the department website. And I've included the link to where you can find that. I also shared that with your chairs. I believe Deanna forwarded that to all of you as well. The department has selected a total of 10 programs across the state to receive $6.5 million in new funding to expand mental health services for children and youth. The new state funding was budgeted by Governor Lee and appropriated by the Tennessee General Assembly in the department's budget for state fiscal year 2022. In the department's announcement of funding, grantees were instructed to collaborate with community stakeholders, including local education authorities and other partners, to design proposals that would have the greatest impact and address outstanding needs. The selected proposals increase school-based services and respond to the increasing need for emergency psychiatric services for children and youth. The available funding under this announcement was divided proportionally among the department's 7 planning regions based on the number of children and youth living in each region. So I have every award grantees for each region on here, but I'm just going to go to Region 3 since that's most important to you all. But in my department update, I have every region listed. So for Region 3, volunteer behavioral health was awarded $900,000 to expand school-based services through the school-based behavioral health liaison program and Project Basic. So exciting news for you all in Region 3. In December 2021, the department and TennCare published the Public Behavioral Health Workforce Work Group Report. The document contains research, data, and strategies for addressing workforce challenges in publicly funded mental health and substance use services, some of which have already translated into state budget requests proposed to Governor Lee. Convened by the department and TennCare over the summer, the work group was comprised of diverse stakeholders from public behavioral health provider organizations, mental health and addiction advocacy groups, colleges and universities, and the department's statewide planning and policy council. Over the course of 3 meetings, participants identified gaps and needs in the public behavioral health workforce, developed detailed strategies for creating positive change, and authored the report for key decision makers. The report's recommendations focus on several key areas of impact, including provider reimbursement rates, licensure modifications, employee benefits and incentives, pipeline career planning, diversity and inclusion, student loan forgiveness, expanding internship opportunities, and communicating to potential students. Budget proposals from both the department and TennCare reflected high priority items from the work group report, including increased funding to allow providers to pay more competitive wages, sign-on bonuses, post-secondary scholarships, and internship opportunities. In all, the agencies proposed $59 million in new state and federal funding to address these issues contained in the work group's findings. Items included in Governor Lee's FY23 budget proposal will be announced in early 2022 when he delivers his annual State of the State address. And I've included a link to where everyone can access the Public Behavioral Health Workforce Work Group report. So that's really exciting. I know workforce development has been on the needs assessment for a few years now. So that's really exciting news. And last but not least, the Tennessee Recovery Navigators are celebrating another successful year of delivering life-changing interventions for people living with addiction. The department is releasing a new annual report which details the program's successes despite a full year of pandemic-related restrictions. Tennessee Recovery Navigators use their own personal experience of addiction recovery to talk with patients at Tennessee hospital emergency departments and try to connect them with treatment resources. The patients they see have recently overdosed, are experiencing active withdrawals, or have presented with a substance use disorder. The Navigator's new annual report details accomplishments for state fiscal year 21, including increased patient interactions over the previous year of 2,967, 76% of patients that they saw were placed into treatment, and 4 hospitals have been added for a total of 42 throughout the state. Now in their 4th year, the Tennessee Recovery Navigators have worked with more than 6,700 patients statewide. And some of the program's earliest patients are in recovery themselves and are working in behavioral health, as detailed in a recent video series produced by the department. And I've included a link to where you can access that video. And I encourage you, if you have the time, to take a look at it. And those are my updates.
Kirby, this is Kibra. You're saying you've included a link. Is that going to be in the minutes or are you posting them somewhere I'm not seeing?
Yeah, no, it's in my department update. I send it to Deanna and Gail and they'll include it in the minutes. So you'll all have access to that. But if there's a link that you need right away, just let me know.
So this is Gail. I'm going to step in for a minute for Deanna to give her a second. And the next item on our agenda is our much needed secretary, as I'm trying to take notes, and Kirby was wonderful to help me last quarter. Secretary, I'll just share a little bit about what the role is, and obviously Avis and Kirby, let me know if I missed something. A couple of primary responsibilities. We're so excited with our increased number of participants in our Region 3 committee, and we want to make sure that we keep everybody informed. And so the secretary maintains our list of members, and including emails and contact information, and then also sends out things like our minutes, notifications that we get from the department or our other partners, and information about our meetings. Obviously, taking minutes at the meetings is really beneficial. And then sharing that both with Kirby at the department to make sure that we've got everything we need there, and then making sure that all of you get that information. Is there anything I left out that's a major role of the secretary that anyone would like to add?
I would say that sometimes you have to assist with audits, but it's something that we all will help with together, me, Gail, and the secretary, with Kirby's assistance as well. But I mean, Gail
and that audit, Deanna, share what that audit is. That was a good one.
I don't know.
Deanna, I'll step in.
Thank you, Kirby.
Yes. So what she's referring to is the department. We get an audit I think the next one is in a couple of years. We had one 2 years ago, I believe. And basically, it's just looking to make sure that we have our accurate, our minutes, our membership list, things that we already have in order. And I have copies of them too. So it's really just me reaching out and asking questions or clarifying things. I think we've kind of got everything in order now. So it's not, that word is always scary, but it's not a scary thing at all. But what I did want to say about the secretary position, everything that Gail has just said is true. It's one of the most important pieces. But I will say, when Danielle, who helped out Region 3 for those few months, we miss her, and she got a job opportunity elsewhere, so she had to leave. She really kind of got everything in order. So it's kind of all there already. It's really just adding on to things that she already put together. I'm referring to the membership list and things like that. And I'm always sending reminders and always there to assist. So no one's alone. You're not on an island by yourself. I'm always there. That's my job, is to help you. So yeah, and one more thing I wanted to point out. I know so many things, and a lot of regional councils are in this position right now as well. Deanna's term as chair ends June 30th, and Gail's term as vice chair ends June 30th as well. And typically in those cases, the vice chair would move into the chair role if Gail wants to. Things happen. We're all busy people, and we understand that. So if Gail does decide to move into the chair role, which I hope she does, we will need a vice chair as well starting in July. So, and that term is for 3 years. And that's not to say you're not required to just stay for 3 years. If other things come up, you just reach out to me and we will work it out if you needed to step down early. But yeah, the term is for 3 years, and the vice chair role, as vice chair of a regional council, you're also appointed to the statewide planning and policy council as well. And it's just a really great opportunity. It's a great networking opportunity. It's a great experience opportunity. So I just wanted to throw that out there as well, just to get that on everybody's radar.
Thank
Just,
you.
just to add, this is Avis, just to add one or two more points to that. And Gail and Kirby and Deanna handled that beautifully as far as the explanation, very specific and to the point. Just want to chime in there to say, let me start with the secretary. With this position, oftentimes with the secretary's position, you think you have to record everything for the meetings and makes it a little bit more daunting. Let me tell you, you do not. You're only hitting the highlights of the meeting. So you don't have to go into depth on everything, every point, every topic, every presentation. You're just hitting the highlights. What makes this really, really easier for the secretary is, one, Kirby sends her update. And so literally you're copying, pasting that into the minutes. So that's about all. If there are other folks that give updates and they can send that to the secretary ahead of the meeting or right after, that's another opportunity to do a copy and paste. So it makes it very, very easy to do. Another plus to it, while we're meeting virtually, we don't know how long that will last. We will reevaluate that for the second quarter. Another benefit of having these meetings in the past almost 2 years when March hits virtually is that we record these meetings as well and post that link on the department website. So you literally can go in and listen to that link for anything you missed and be able to capture that, and won't have to try to write so fast while you're in the meeting trying to capture the minutes. So those are some added points just to know. And secondly, with the vice chair position that will be available if Gail moves up into the chair role. Another thing to note about that is that if once you are approved and appointed by the commissioner, those individuals, the chair and the vice chair, as Kirby said, serve on the statewide council. Just remember that the statewide council is an advisement body to the commissioner on needed supports and services for the individual we serve. And that's a really important role to fill, to have the commissioner's ear for things that are very important to our regions across the state is really good. And as appointed member of the statewide council, you really have an opportunity to have even more of a voice. So just keep that in mind as you think about, as members on this council, think about possibly being nominated or nominating yourself to serve in that role. That's it. That's all I just wanted to add.
Thank you so much. So do we have any nominations?
This is my favorite part.
We have 22 people on this call. 3 of them are with the department. 2 of us can't do it. So 17 more people that could potentially be a secretary.
And there might be someone that's not on the call that might be interested. And I want to say, was Danielle referred to us by someone else the last time? So even if you have someone that maybe you work with in your agency that you think this, I mean, if they have the time, obviously, and are interested in it, but that's also something too, especially if you have maybe a new person within the field that's looking for more experience or more networking to get out there, something to think about as well.
Any nominations or anyone that you think that would be interested that we could reach out to? Okay, well, think about it and email Gail and I. I mean, Kirby, what do we do if no one volunteers?
You just kind of make it work.
Okay.
I mean, right now the meetings are recorded, so that's very helpful, especially with the minutes. And they are minutes, they're brief. And my department update is always sent, like no one has to take notes on my department updates, copy and paste to put into the minutes. You're not the only region going through this, I promise.
Okay.
People are busy.
Hey,
I know,
this
I get it.
Kirby. Hey, this is Kurt. How long will the secretary appointment last?
3 years, each term lasts 3 years. So secretary, chair, and vice chair.
Okay.
I want you all to know that
Thanks.
I've been doing this for about 7 years, so you all can do it too.
Yeah, I want to say, typically, you know, the secretary eventually will move into the vice chair role, and then the chair role that you kind of, so long as someone's interested, of course, and they're able to do it.
Also, there may be some individuals that's not on the call today that's actually attends the meeting, maybe regularly or intermittently. So another option, Gail and Deanna, may be to send out an email after the meeting to the entire email group that you have, and put that out there. That you're looking for a secretary, and see if you get a response that way as well.
Yeah, we've done that, but we can do it again. Okay.
I was just mulling it over for myself because I know I feel the pain, and I'm thinking if I could get someone to take over my role as subcommittee chair, I would be willing to move into that position. So anybody that's on the subcommittee that would like to maybe move into my role, I would love to. I could kind of help out with that, I think. And I can also mention that at our next meeting.
Okay.
Okay. Is there anyone on your subcommittee, Amy, that's here today?
I saw Ruben, Nicole, going through the list. I hate to put anybody on this.
Chair of our policy.
Oh,
right
she's
now.
policy. That's right. Okay.
Unless she wanted to change. I mean.
That's right. That's right. That's right. Kara. That's all. So yeah, not a whole lot. So I could, like I said, we meet next week.
Okay, great. So we'll put out the email, and then yeah, Amy's the one that found Danielle for us, and Danielle hadn't been involved with this prior, and she did an amazing job, and hopefully she takes her experience wherever she went. So okay, we'll keep on it.
Okay, I have texted someone that I think would be a good chair for you, Amy. So we'll move on. We'll have some sidebar conversations, and they'll be nominated. If Amy does end up nominating for that, we will send that out to see if there's any that disagree, and then that's how she'll be voted in. Okay, needs assessments. So Kirby, you already discuss this. Was there anything else you needed to cover for the needs assessments besides the dates?
No, I think because I know in every regional council handles the needs assessment differently, and I believe in Region 3 you divide yours up amongst the adult committee and children's committees, correct?
Yes.
So, and I believe in October I had reminded everyone that the number of needs have changed, so you can submit either 2, 4, or 6 needs depending on what the needs are in your region. So just as long as they're equal representation of mental health and substance abuse. We didn't want to force 6 on everybody, but we wanted to allow people to put more if they want to. And just a reminder, because I know we do have some new people on the call, if you're interested in participating in the needs assessment, whether it's the adult committee or the children's committee, please reach out to Amy. You're over Children's committee or adult committee?
Children.
Children, I thought so. Reach out to Amy. And who's over the adult committee?
Hi, that's me, Trish Cunningham.
Okay, I know I'm getting everybody confused. Hi, Trish. If you want to reach out to either Trish or Amy, I know they would be happy to have as many participants as possible. It's a really important process. As you can see, I talked earlier in my update about the workforce development, and that has been on the needs assessment for a while. And not that no one was listening, everybody was listening and everybody knew, but sometimes it just takes enough collaboration with other departments too in order to get things done. So that was a lot of persistence on the regional councils and the statewide committees. So very important process. So I encourage you to reach out to either Amy or Trish if you're interested in participating. And due date's April 1st, and I'm here to help with whatever. If you have any questions, don't hesitate to reach out to me.
Yeah, so we, like Kirby said, we have found that this seems to work better, especially because we're not meeting anymore in person, at least right now. It allows you all to kind of work on these in your committees. And then from there, Nicole can create any legislative proposals. So we will have another meeting before, right? Probably March, well, maybe March, right? Is our next meeting?
No, we don't. Region 3 doesn't meet till April, till after the needs assessment. Every regional council is in the same boat, I promise.
Okay, so then we will need to. I'll be doing a lot of communication with the chairs and vice chairs. So make sure that you are having meetings outside of this. And if you want to join the adult subcommittee, Trish has kindly included her information in the chat. Okay, we're going to move to committee reports, and Trish, we will start with you for the adult subcommittee.
Hi, good morning, everyone. So as you know, I'm still kind of new to this role and trying to basically, I guess, just figure out how best to approach it. And so my approach has been to try to incorporate as many counties as I can and try to increase collaboration amongst our 23 counties because it is a very large region. So I'm still working diligently to include more of our smaller communities just to make sure that we have representation across the board. And I think that, you know, like I said, I have been working on that, and we do have some representation even on this call as well. So I'm very grateful to everyone that has taken time out to join this call today. So we're still meeting. I try to get together at least once a month to try and, you know, figure out some of these challenges. And what seems to be sort of a common theme is that sort of what happens in one area may not be happening in another. It's a very vastly different area, considering that we've got Chattanooga as, you know, a big urban area, and then 22 other counties, most of which are rural. So there are a lot of great initiatives that are happening across the state. And I think what I would like to do is just take a deeper dive into what those initiatives are, because they do seem to be posing as challenges in a lot of communities. So maybe bridging the gap between what's already in place and then how it's being implemented and rolled out. Because like I said, I feel like there are a lot of great initiatives happening, but they're not quite reaching all of the 23 counties and all of the areas. But we are kind of honing in on some other challenges, and we will continue to meet monthly, and just we will have our challenges outlined by April 1 and have those on the needs assessment. But in the meantime, the more representation I can get, the better. So if anyone on this call, you do want to join, it's a very informal meeting. We really just kind of talk about what's happening in your community and challenges with access to mental health services and substance abuse services. And we just try to just go from there.
Okay, thank you. Sorry, for whatever reason, we use Teams at work too, and it just, the getting to the mute button takes this like awkward 3 to 4 seconds for it to even come off. So, okay, Amy, back to you for the Child and Adolescent Subcommittee updates.
Thank you. Hi, good morning, everybody. We are really excited and grateful for the participation that we have had with the Children and Adolescent Subcommittee. Many faithful attendants coming, lots of new faces. We've had a big turnover and who was coming and who's now coming, and we have just a lot of good interest and new ideas and varied participation among disciplines, even outside of the mental health field, which is really exciting. Like Trish, we would love to have more statewide representation. Got a little bit of traction with that, but then kind of fell off. So probably need to do a better job to keep that going and that motivation going. We are narrowing down our needs and working really hard on that. And I feel like we've got some good traction with our substance abuse need, specifically looking at adolescent vaping and programs available for them. And then we're still kind of trying to narrow down our behavioral health need. And so it looks like we hope to be able to submit, one from each category. We're aware that we could submit more, but I tell you, it's tough to even get, still tough to get one from each. So that's our goal. So that's what we're working on. So anybody that might be interested in bringing forth issues that are related to the behavioral health needs of children and adolescents, if you guys on this call or know people that are passionate about that and would like to be a part of a team that is exploring the needs and the issues so that we can kind of come up with some thoughts and ideas to bring back, we'd love to have you guys join. So thank you.
Thank you, Amy. Nicole, do you have any legislative subcommittee updates?
Good morning, everyone. And as Deanna already stated, we are still kind of in the process of waiting for the needs assessment so that the subcommittee can process that information to identify any legislative needs. So at this point, we're kind of in a holding pattern. Nothing has been brought forward from the subcommittee or from any outside perspective at this point.
You're on mute, Diana. You're on mute.
See, I'm telling you, I clicked the button and it didn't come off. Sorry. Thank you, Amy. So for any consumer update questions, Rachel has been helping us with that piece of the agenda. Is she on? Let me go to participants. I'm not sure that no, she. I'm looking through. No, she is not. Okay, so we will just table that for next time. Going to providers and community updates, announcements, any hospitals, medical or mental health on the call. And if not, we all are out there in the community, and I didn't know like if you are in passing with any of these key players, if we can get them back to joining this call. For a while we've had Erlanger, Tenova, Park Ridge Valley. I remember back in the day we had a couple from Park Ridge Valley. We've lost a couple of those leaders to other positions into the community, and I do think that's why those positions have stopped attending. But I do think it is very vital to have all the different types of key players at this meeting. So in your sidebar conversations with them related to your own agencies, if you can remember to invite them to this meeting, it would make it even more beneficial. Okay, Consumer Advisory Board. Okay. I thought, was Rachel not assisting with that piece too? Or is there someone reporting for that as well?
Hey,
Gina?
this is Gina.
Oh,
Yeah, hi, Gina.
Gina,
Thank you.
Sorry, got a couple things happening all at one time. We are looking for members. Someone with lived experience in substance use disorder for regions 2, 3, and 4, and someone for lived experience with mental illness for region 4. So if you know anyone who would like to serve, please let them know. And also, plans have started for the CPRS conference, which will be in October. The official date's not been totally solidified yet, but we are hoping to have it in person. That is the plan right now. And that's about it for right now.
Great, thank you, Gina. United Healthcare.
Hi. Hi, this is Kubra. I just have a message from Executive Director, and he just would like us to know, all of you to know, that we are incredibly honored and excited that we will be continuing our partnership with TenCare into 2023 and beyond. So we're here, and I'm here again, sponsoring events in the community. Please reach out.
Great, thank you. Anyone from Blue Care, TenCare Select? Okay, I'm gonna go back to mental health providers. I wanted to get through the shorter pieces first. I would like to start with Gail. She has something that she wanted to discuss from the provider side, and then as we go through, just feel free to speak up and give any updates or things that you're seeing in the community that we need to discuss.
So I'm actually going to pull Trish Cunningham in as well. I just wanted to make sure everybody here was aware of the ARP funds. They are going through in Chattanooga through the city. I wanted to give the opportunity for those of you in some other counties to share if you know of these funds and if you are aware of how to apply for them and access them. Here in Chattanooga, the primary focus is housing options and supportive services to maintain housing. So I just, Trish, if you could just jump in with a few sentences of some of the work you're doing in terms of helping people apply for those funds, in case there's others here that might be interested in applying and accessing them.
Sure. Deanna, you're right. There's definitely a lag in the, it's an awkward, so sorry. I'm going to drop the link to this, the webpage for the ARP funding that the city of Chattanooga is distributing, just so everyone can take a look at that. The application is actually on there with some additional supplemental information. As my role with with the Creating Homes Initiative, I don't know how many of you are familiar with that, but so I work to increase the opportunities for more affordable housing for individuals that are in recovery from substance use disorder, have co-occurring disorders, mental illness, and or have incarceration or reentry in their experience as well. So this funding is targeting affordable housing. There's lots and lots of dollars that are being funneled through the city of Chattanooga. Applications are due February 6th. The application does appear to be straightforward. And, it does ask for, things such as what's your project type? What is your budget? How does this fit in with the American Rescue Plan and the recovery actions? But as I listed before, you can certainly call me if anyone does have questions about the application or if your project might be a viable option for this. Not that I'm a representative of the city or anything, but I can definitely help with maybe some technical assistance. But yeah, it is a great opportunity, and the more units, the better. I will have to look up what the city's goal was as far as how many units. I know that it was a high number. It was definitely a high number for the amount of units they want to add for affordable housing. So, but entities can apply, as far as I understand, churches, smaller organizations, those kind of things. So please don't hesitate to reach out. I am working on some applications, helping some other agencies. So I would be happy to help answer some questions for you.
Thank you. Problem is you click it and then you think that you're unmuted and then it messes up. Thank you so much. Gail, do you have anything else you wanted to add for that?
No, that's it.
Okay. So what I'm going to do is just you guys open up, talk, and then when no one talks anymore, we will end the meeting and adjourn. And I'll speak up. So here you go.
Good morning. This is Donna. Am I live or am I mute? All right, good. And then I waited. Morning. I'm thrilled to make an announcement on behalf of the AIM Center, and I think most of this word has gotten out to most people in town, but it is formally coming out. But we have welcomed a new president and CEO to the AIM Center, and she's on our call today. And many of you know her in Region 3 already, but it's Anna Platino Biggs, and Anna's there on my screen and sitting across the hall in an office that I'm somewhat familiar with, but we're just so excited to have her in a leadership role for the AIM Center, and her background is such that she brings such skills and wealth of knowledge and a sensitivity to working with vulnerable populations, but we know she's a change maker, and we're just so excited and appreciative for our board of directors for finding this great new leader for us. So Anna's been in place, and we'll now need to get her changed over from the mental health court over her email addresses over to this and get that updated. And but we just wanted to share that news. I'm going to be kicking around for just a little bit more time around the AIM Center to assist Anna in her transition, but also to continue a couple of special projects we're involved with at this time. But I just say, welcome, Anna.
Thank you, Donna. And yeah, I'm excited to be here. And most of you know me from Mental Health Court, but excited to be here at the AIM Center, a place that I have loved since I came to town, and it's a special place. And just to add for updates for the AIM Center, I think just, we're here and trucking away. But one of the exciting things is that we've been working on getting one of our recovery coaches, Julia, to finish her hours for the CPRS. And so she has just completed those hours. So we'll be looking forward to having her fully certified as well now.
Hey, hi everyone. It's Eve. I hope it says Eve now instead of Evelyn. I always feel like I'm in trouble when someone calls me Evelyn. So, and I didn't know how to change it, but I did want to announce a couple things from the Crisis Intervention Team, CIT. One is we do have dates for our upcoming school, March 21st through the 25th. We'll be able to put another round of first responders through Crisis Intervention Team training and have them join our Crisis Intervention Team program. So we're really excited about that. There's opportunities for sponsorship. As you know, the CIT program is completely volunteer supported. There's no funds from anywhere that go towards that. It's just completely supported by our community.
And even the officers volunteer their time outside of their regular duties to go through the school and agree to be on call. So if there are crises. Along those same lines, I did want to point out, just because I know that the hospitals aren't on here, but we have a crisis provider meeting that meets regularly just to discuss mental health needs in the community, specifically those that are in crisis or post-crisis or subacute crisis. One of the things that was brought up by one of the directors of emergency services for an area hospital is he mentioned that they are really in crisis. He said they're overwhelmed with psych patients, they're overwhelmed with medical patients, they are critically short-staffed, their staff are constantly out sick, kind of to the point where people are working while sick because they just don't have enough staff. And I feel like this isn't getting any press. I mean, a year ago, we talked a lot about the hospitals being overburdened, but I feel like we're not getting any sort of press about that. We had our, heroes work here and healthcare heroes, and now everyone's just kind of forgotten that they're still really, really in the throes. And I saw the numbers today. Those hospital numbers are going back up to where they were in the highest peak of the pandemic. So just wanted to throw that out there. If you have resources for healthcare workers, he mentioned it would be great to have a support group for healthcare workers specifically. And I know this goes for mental health workers too, as we've seen a spike in acuity with behavioral health patients. And a lot of us have been dealing with them on the street and in our offices in the highest acuity that we've ever seen them. So you could forward that to me. I can forward it out to our crisis provider group, any resources for healthcare workers. But just wanted to put that out there too, that, make sure we don't forget about those hospitals and what they're going through and kind of how that impacts our behavioral health folks as well.
Hello, my name is John Rust. I wanted to introduce myself. I work in Cookeville for the Power of Putnam, which is our prevention coalition for Putnam County, but I work specifically with a grant called Drug Endangered Children that's funded through the Tennessee Bureau of Investigation. And so they ask us all, there's 7 of us across the state, to participate in our respective policy councils. So I'm excited to be a part of it and kind of jump back in this field in this way. One of the things that we're working on that we're most excited about is to try to find resources for children and families that have experienced a drug overdose and death by overdose. And so any kind of ideas that you all have, it's always difficult to find the data really quickly when someone does pass away. So we're thinking of doing kind of some resource kits and leaving them with school systems. We have a person that's in place in our regional hospital, and just doing some things like that so that when the need arises, that we could quickly have some resources for those families. So again, excited to work with you guys and excited to partner with you all.
I just want to point out to those of you that have access to the chat that Kurt provided a great resource. Thank you, Kurt, for that. On the state's website, there is behavioral health emotional support. So you can copy that link down. I will make sure to include that also in the minutes so that other people can see that. I think Deanna had to get off. Are you still on, Deanna, or did you have to get off? Okay, I didn't know if it was too close to your next one. Okay.
I moved it because I figured we would go over a little bit, so we're good.
Perfect.
Other people that want to talk about any community updates?
Hey, I'm Billy Webb from Ventures County here. I direct Manor House Ministries here in Jamestown. We are addiction recovery provider. We provide multiple recovery services. Also one of the founding members of the new Fentress County Prevention Coalition. I just wanted to kind of introduce myself. I can't remember if I did the last time I was here, but I'm still kind of feeling like the new kid in class and don't know where to put my books at yet. So, but I just want to say I appreciate all you folks and wonderful folks I've met over the past, I guess, couple of years now. You know, Miss Trish Cunningham there, I think she reached out to me or we connected somehow. And just for us here in Fentress County to get networked and connected with some of you folks and understanding what resources are available to our rural areas and how we can go about navigating and creating some of these opportunities here has been a huge insight impact for us here, especially at Manor House and some of the other organizations that I'm partnering with here in our town. As far as the hospital situation goes, we've not had a hospital in a couple of years, but we do have one that will be starting here in a few months, and I'm hoping, going to try very hard to get connected with them and see what kind of services we can provide together, and at least get some of those professionals represented here in this meeting, in this committee. I think would be extraordinary for us here. Updates as far as what we're doing here at Manor House. We are working hard. I've been able to work hard with some other professionals in the field here, counseling, to try to put together, to be able to offer an ILP program here at Manor House, which is huge for us. I mean, we don't have that here in our area. And I've got to connect with them and let them know that we are connected with the Region 3 and other professionals and other providers there. Some of my supervisors as an LPC intern, they're excited, they're ecstatic about that, and they want to help out in any way that we can to bring some of these resources to our county. So again, I'll hush now because if not, I'll talk forever. But thank you all so much for inviting us and allowing us to be a part of this. It means a lot to our area.
Can you please put your contact information in the chat box?
Sure.
Can't see whose hand is raised. Laura.
Hi. Yes, I'm Laura Pierce, and I'm the newly elected, I guess, current president of NAMI Chattanooga. And so I just wanted to introduce myself and maybe give a quick update on how things look from our end. We do attend the crisis provider meetings, and that's been incredibly helpful for us. We're teaching a family-to-family class right now, and it's full. And I think we had another whole class we could have started right now. There were so many people that called. Support group was 24, the last support group. So again, that's probably double what we normally would see. And helpline calls are really increased. So there is a lot of need right now. And we're trying to get through. We are all volunteer currently, but hopefully we will get a paid person that will allow some continuity and all for our organization. And that should help, I think, with getting some more volunteers, et cetera, and helping to try to meet some more of that need. So anyway, thank you. And I will put my name and number in the chat as well.
Thank you. See, no other hands raised. Anyone else? Okay. Our next meeting, this doesn't seem right. It says July 14, but that's 6 months from now.
I think it'll be April, right?
It's April.
Yeah.
It is April the 14th. April 14th.
So our agenda will need to be changed on that because it says July. Okay.
I didn't either.
What?
I completely missed over that too.
It's okay. I mean, July feels very warm compared to what we're going to be dealing with this weekend. Okay, if there is nothing else, no last minute comments, then we will adjourn and we will see and talk to everybody on April 14. If you have any questions or need to be added to any email lists or anything of that nature, please feel free to email myself or Gail. Have a great Thursday.
Thanks, Deanna, Gail, and everyone.
Thanks, everybody.
Bye.
Bye.
Bye.